Thanks, John. Well done. Welcome, everybody. It's great to have you all here as we wrap up the 2020 cohort in Propel. Seems a shame not to telling you about there aren't any fire alarms scheduled, and we don't have to tell you where the toilets are, but I'm sure you know all that about in your local environments. But really, today I just wanted to sort of come in and I suppose maybe thank everybody who's been involved in delivering this program over the past year. It's been a really, really challenging year for all of us. The Yorkshire Humber HSN has been, I think we're proud to say that, in many ways, Propel at Yorkshire Humber was our idea. We pushed this forward right from the get-go 2 years ago. But we couldn't have done it without all of our companies who have joined us on the journey, and without all of our sponsors and their support as well. And really, I think this is an opportunity to talk about success, about the great stuff that we've done over the last couple of years, but in particular this cohort. And I think I just want to take you through a few slides here to sort of set the scene and remind you about why we're here and what we're trying to do, and what the opportunity is for all of us to move things forward collectively as innovators, as participants in this program, as sponsors, as the AHSN, and where we go next as well, because this isn't the end. In fact, for many of you, this is sort of the start of the journey, the end of the beginning, to be a bit Churchillian. But I think there's so much potential in this cohort, and we really look forward to staying with you as you continue on your journey. The next slide, please, John. And one of the things I want to tell you, that the HSN is not in Yorkshire and Humber, it's over the whole of England. And when you're ready, you should be flexing that network. So, when you're coming into the market and you're ready to go for global domination, start by engaging with us in the HSN and the wider HSN family, and we will help you on that journey to have the right people in different areas talking about what you're trying to do. As I said, there's 15 of us. There's natural variation across the 15 in what immediate needs are as much as anything else, and there is a little bit of a need to try and have your conversation in the place that has the most need for the solution that you're offering. And again, we'll help you with that. And you've got other people like Barclays who have been involved in the program, the Eagle Labs program. They have similar networks and connections as well. So don't be afraid to flex and to use them to help move your business forward over time. Next slide, please, John. Why are we doing this? Well, from an HSN's point of view, we are commissioned to improve the health of not just patients, but of citizens really across England. So that's our main driver, and obviously driving down health costs, driving efficiencies into the NHS is really, really important. And if we do all that well, we will help economic growth expand in the UK. We'll help you to grow your businesses, to create jobs, to secure investment. And we are still looking for our Yorkshire unicorn in health tech through the Propel program. So is it you? How do we help you on that journey? So we think all these things are interlinked. If we drive health improvements and reduce costs, we will be building good, successful businesses in the region, and that's really important to us. And as you grow, we want to help you grow into that national provider and an international provider as well. So think of us as you grow and as your journey continues as a business. Next slide, please, John. Thank you. And this is a snapshot of our region as it is, and it's a big region. You all probably seen this slide before. We're bigger than Scotland, more people than Scotland. We have a £12 billion turnover in health and social care. We've got 22 acute trusts, 6 teaching hospitals, mental health trusts, 20 clinical commissioning groups. So that landscape's going to change because the clinical commissioning groups are going to come with legislation under the auspices of the integrated care systems. So there's always change in the healthcare system. We will help you navigate that moving forward. We've got nearly 800 GP practices, nearly 1,500 care homes in the region as well, loads of universities, and as you can see, you are part of an ecosystem of nearly 700 life sciences companies. So you're in a really healthy, vibrant economy. It's hard to navigate because it's big and it's complex. As you continue on your journey, keep docking in with us. We are as interested in your success as you are, and we want to be part of your success as you move forward. So that's the challenge in Yorkshire and Humber. the same patterns repeated across the country. And again, the HSNs are there to help you navigate some of that messy environment that is out there. Next slide, please, John. So, we're still proud to say that we still think we're the first regional digital health accelerator program, providing you guys with what we think is an innovative offer in terms of what's in the program, what we're helping you with. It's a program we're really proud of. There's some fixed assets in that program that are excellent, and we'll get to some of those in a second. But there's also, John works tirelessly for the HSN and on your behalf to try and bring you the content that you want and that you need. And the program will be different next year than it is this year. And it's different this year than it was last year. We're constantly adding, adapting, and trying to improve that program and bringing in new content for you as well. So if we've missed anything this year that you think we should have brought to the party, let us know and we will try and incorporate it next year. If there's stuff that was particularly useful this year, make sure you feed that back to us as well so we can build on that next year as well. I think one of the things I want to do on this slide in particular is thank our partners. John, even the next slide I think is maybe the right slide for that as well. So we could not do this without these key partners. So Barclays Eagle Labs, Hill Dickinson, Leeds City Council, Nexus at the University of Leeds. This program doesn't work without their support as well. So, the Eagle Labs, they have a great national network as well. Big thanks to Dawn and Jen for letting us just tap into your wider networks really, and really, some of that content, that simple banking content and that reach into your networks really, really vital for what we're doing. The Leeds City Council, they keep us really grounded in what we're trying to do by challenging us to say, is this stuff that is going to help the citizens in our region? And that's really vital support. It keeps us grounded. It keeps us focused on innovators and innovations that are really going to help what we're trying to do in our region. And that support's vital, and being able to plug into that conscience as much as anything is really, really important to us as well. We can't do this without Nexus. You haven't probably had the full benefit of being in Nexus this year, but actually that community membership that Nexus puts on the table for us is so valuable. And if you haven't exercised that, you should do over the next number of months as well, where you can. It's a great space to grow your business in as well. And, without their support, we can't do any of this, whether it's been virtual or whether it's physical. We can't do it without their support. And it's a big shout out to Harrison in particular, who I know has put a lot of time and effort into supporting the program as we've moved forward. And Hill Dickinson, why have we got a law firm involved in this as well? Well, actually building your business properly, having really good sound legal advice now, we think is a really vital component for you to build your business moving forward. Again, we couldn't do that without, the support of Hill Dickinson. And we think, and we would think this, and we would say this, that's quite a novel set of partners all being brought into a health digital accelerator program. And I hope you feel that that's been useful and beneficial to you as well as you've gone through the content. And I guess there's a special shout out as well to M Habitat, who provide a lot of our content for us. So Roz, Fran and Gemma for running the masterclasses. Digital inclusive transformation is something that is increasingly being talked about as absolutely, this is a must do in the rest of the country. We are already doing it in this part of the world, thanks to some of the content that Roz and her team are providing for us as we move forward. And, others who have been really helpful in the program who need a special shout out is, I think, Jennifer Robson from the LEP, who's been involved in the program this year. And I think we've managed to draw in Louise Birmingham as well from the LEP. Really great assets to bring close to the program as well. And I think we had Nina Wilson from NHSX did a session on DTAC, Digital Technology Assessment Criteria, just recently as well. That wasn't in the program last year because DTAC didn't really exist. So, the ability for John and his team to pull in some of these interesting speakers to bring you the latest information to help build your digital business is all something that's been really valuable to us. And we hope to build more partnerships into the program next year, to bring more content to the program next year. But actually our core partners, as you see in this slide, we can't do it without them. So, big thanks to them for engaging with the program and engaging with you. And I think I've got, is there one more slide left, John? Just to let you know that the program doesn't end now. Here's a case study about DigiBeat, who were on the program last year. And we're really interested in what happens after you leave Propel as well. And Digibeat have gone on to great success. They've leveraged funding. They've built an NHS contract, which they didn't have at the start of the program. And so there is the opportunity to step on now and to use what you've learned to help grow your business. And I think from cohort one, we know that we've leveraged in over £1.5 million worth of investment into several of the businesses. We've helped create 9 jobs. We've secured 3 of the businesses in the region. We've set up 7 research collaborations as well. And I know some of those you've already started some of those in this cohort as well, which is great. And as I said, we developed at least one NHS contract on the back of last year's work, with that cohort. So we hope, again, as I said, to go from strength to strength moving forward. We know some of you have already built some really good relationships in the Leeds community, academically and in the health service, and we hope to see you build on them over the next year. So don't be a stranger to Propel. If you've got any questions and queries as things move forward, please dock back in with us, and we wish you every success with your business ventures as you move forward. And I hope to speak to a few of you over the next few months as well to get an update of where you are and where you're going as well. And I guess I'll finish there. Big shout out as well, before I forget, is to John, who has done the donkey work, pulled the program together and done all the hard yards. I've sailed in at the end and been able to talk about some of the great work he has led on the ground as well. So big shout out to John, and thank you for your efforts. And some of the wider team, I know, have helped you. I know Pete's been a great supporter of this work as well. So well done. So I'm going to hand back to John now, and he'll take you through the rest of the day. Thank you very much.
Fantastic. Thanks, Nev, very much for that glowing endorsement. It's much appreciated. So yeah, as I said earlier, my name's John Fordham, the digital navigator at the Yorkshire and Humber Academic Health Science Network. So just wanted to talk quickly kind of say what we've been doing for the last year before we're going to get stuck into the main reason we're here, really, to actually going to hear from the companies and hear what they're doing, really. So I think it's almost, I think, 2.5 years now I've been sort of leading on the Propel programme. So it's been great to see how we've progressed and how our partnerships have grown over that time. As Nev said, it's without these partners, we can't do what we do, really. It's about having a toolkit with as much in it as possible to kind of help people in as many different ways as we can, is how I'm kind of looking at it. So it's the more we can grow that, the more benefit we can get or deliver to the companies that have taking part. So we've been kind of working quite intensively since it was kind of October time. We sort of first met the companies face to face, although it wasn't in a physical setting. It was a virtual setting, which was very different to how we'd planned the year. So initially we had actually opened applications in January 2020, which seems an awfully long time ago now, and that was in the days where we were going to be based at Nexus, having physical meetings and networking events in the fantastic building they've got there. And then obviously things changed, and things were put on pause very early on in 2020, where we had to take stock of how can we do what we need to do, really. So because last summer, June, July time, we're looking at how the situation had been progressing, and I think the decision between the partners was made that we still have the opportunity to deliver some benefit in a virtual world. Everyone had kind of started to adapt to virtual meetings, kind of webcams, and kind of getting your desk set up in your attic, as most people did. So a decision was made to kind of relaunch the program last summer. With a kind of a Propel, with a kind of a COVID theme as well. So looking at how can we kind of help and identify companies that will benefit the system in some way in relation to COVID. And I think it was very clear that COVID's had an impact on every single aspect of everyone's lives over the last couple of years, and a lot of the companies we're looking at today, they're not cures for COVID. It's about how can we relieve pressure on the system, how can we enable kind of improved self-care for patients, and it's all these things combined together have a huge impact on the health system, and the idea is to take a bit of that pressure away. So we kicked off applications last August. We had over 40 applications in total. So moving to October was the assessment of all those applications. We had an assessment day middle of October, where we had our partners representing their organisations. We had patient patient representation. We had representation from industry and the health system as well. So we had a very rounded selection panel to make sure we got all those different perspectives, different priorities, particularly from Leeds City Council this year. Very environmental impact was a key thing we wanted to kind of consider. It's something that is starting to be seen as more of a requirement in kind of bids and tenders now as well. So we kind of took everyone's priorities, experience into that process to kind of select the 10 companies that we'll be seeing today. So it was quite a busy few days online, kind of seeing pictures from companies and working through it. But it was it was kind of satisfying at the end. We got the right list, the right companies, and the proof is, I think, since we've been working with them, they've been a great group to work with. So that's really really nice to see how that group is selecting the right people. So the actual program itself kicked off in November, and that was, as Nev said, with our kind of delivery arm, Habitat, who we put a sort of a string of masterclasses together, which really gives us a kind of a backbone structure to the program itself. So day one, getting to know the NHS. Nobody knows everything about the NHS. No single person. It's very much gathering different perspectives on the structures, and moving through into kind of clinical safety regulation, building an evidence base, looking at managing complexity with the NASCAP tools, looking at co-design approaches. So we kind of followed this program through into the spring and where we are now. But in parallel with that, obviously working with our partners as well. So Nev mentioned working with Eagle Labs, bringing in their high growth banking expertise, bringing in WorkFind to support the businesses, bringing in mentors, looking at commercialization. So things we can't deliver ourselves, but we're working with our partners, brings these extra strengths in. Again, Nev mentioned working with Nexus, really kind of opening the door to that. So all the 10 companies on the program have got a 12-month community membership at Nexus this year. So as we say, this isn't the end of a program; it's the start of a longer journey with the AHSN. But in a very literal, practical sense, that these companies do have a 12-month membership, which has kind of roughly kicked off in the last couple of months, and then the team there already building on collaboration opportunities, research opportunities, grant opportunities with the team there. So again, it's another dimension we've been able to bring to the program as well. And then working with Hill Dickinson, done a deep dive into the legal complexities of running a business, running a digital health tech business. There's one thing, understanding what your problem and solution is that you're delivering, but there's the practicalities of how you structure a business, how you employ people, pensions, all those sorts of things, which isn't what the first things you think of when you're kind of developing a digital health tech solution, but it's the practical things that you need to know to kind of help you move forward and get in the right place that you need to be able to scale and actually deliver what you've been developing. So yeah, it's been a kind of a strange kind of year or so. We've all been kind of on a journey together. Everyone's sort of adapted to this kind of virtual delivery way of doing things. I think there's been some big positives in terms of how we've delivered things virtually. It's made life simpler in lots of ways. Getting engagement from wider geographic areas. Got friends, Erica and Craig over in Hull. Kind of it's good to kind of get the spread the reach in the region. But I think looking to the future, we've got to want to make the most of the benefits of virtual delivery, but also it's when it is possible, those kind of networking presentation days, getting groups together is something we want to move towards as well, and a kind of a hybrid approach. So taking the best from all the different kind of lessons we've learned over the last couple of years. So I think all the companies here, I mean, it's easy to forget, they've got a massive potential to make an impact on people. It's at the end of the day, it's individuals, it's you, me, it's everyone, our families. They are the people that will benefit from these solutions. So it's got a huge amount of passion. It's really brought into the problem people are actually kind of solving. Most people have a personal story of some sort, which led to them actually developing these solutions, trying to solve these problems really. So I think for me, it's very heartening to see people kind of taking the risk, taking the plunge, to kind of go for really try and make a difference and make an impact on people's lives. So we're looking for support, collaborations, help for these companies to really kind of take them to that next level. So I think with that, it's probably enough of me talking. But these are the 10 companies we're going to be looking at today. But I've always fallen the trap of talking about them myself a lot, so I'll leave the talk to them. But for now, I will stop sharing my screen so you can actually see the people that we are talking to today. And we're going to run through. Everyone's got roughly 5 or so minutes to give a quick presentation about themselves, tell us about their solution, what is the problem they're trying to solve, what do they need to move them forward. As I say, we've got the chat function there, so please do chip in to the chat as we go along. We do a Q&A session at the end as well, so if anything crops up along the way, we can cover that off in that Q&A session as well. And if you want to get in contact with any of the companies, again, we can kind of follow up. I'll put my contact details at the end, so we can get you linked up and joined up. But first on our list today is Nikhil from Vast Minds. So I will find you in my list. There we are.
Hey, John, can you hear me?
Yeah, that's loud and clear. And I've just put you on spotlight, so you should be center stage to everyone as they come through. So yeah, if you want to crack on and tell us what you've been up to.
Sure. No, thank you so much, John. And I just want to thank everyone else on the Propel and YH AHSN who's provided us with so much support. I mean, this program has been invaluable for us. So just want to take the opportunity to thank everyone there. But hi, everyone. I will try and do this in under 5 minutes, I promise. But my name is Nikhil. I'm the founder and CEO at Vast Minds. I myself am a computer vision engineer and have spent the last several years implementing machine learning solutions, initially in finance before applying those same skills to healthcare. And at Vast Minds, we are really trying to aim to make physiological assessments more accessible and ultimately assist with reducing chronic disease development. And by 2030, we have an ambitious goal to assist in reducing worldwide deaths attributed to chronic disease by 50%. And the problem really that we're trying to solve is that a significant proportion of healthcare expenditure is attributed to treating individuals with chronic and mental conditions. And for example, in the US, of the annual $3.5 trillion or so that is spent on healthcare, 90% of that spend is for people with chronic and mental conditions. And this is a growing problem, especially in developing countries where accessibility to healthcare is scarce. Now, telemedicine is partially addressing the accessibility issue by providing a convenient way for patients to connect with healthcare professionals. But there is currently no way of remotely monitoring patients without potentially costly physical devices. And our solution is a deviceless software tool that simply helps anyone understand their health better just by looking at their face. More specifically, we use computer vision technology and advanced signal processing to measure color variations on the facial skin. And that allows us to extract an individual's real-time pulse rate, their oxygenation, the respiratory rate, their stress levels, and other key physiological parameters in typically seconds. And our technology can be remotely installed on smartphones, laptops, and other regular consumer technology devices with an embedded camera, of course. So allowing anyone that possesses such a device to conduct regular physiological assessments without the need for physical devices. And one of our USPs is that we are able to extract the cardiac rhythm of an individual with great precision. And this has the potential to unlock the ability for us to delve deeper into better treating high-risk cardiology populations. And in terms of our traction so far and what we have achieved, Vast Minds itself has already secured a number of global partnerships with clients in industries ranging from telemedicine, life and health insurance, and aviation, to deploy our technology in order to improve well-being for a significant number of users. And some of these clients include global organizations such as General Reinsurance and AirAsia. And VastMinds itself has also been recognized by Microsoft's AI for Health team as an innovator in digital health. And we work closely with their AI team to accelerate the adoption of our technology in developing countries. The team at VastMinds comprises of an experienced group of computer vision engineers, medical scientists, and AI researchers. And our primary focus as of now is to secure more partnerships with an increasing amount of early adopters for our technology, and to also secure academic collaborations with research organizations. And that primarily is to keep us innovating, conduct further studies to hopefully support our CE and FDA approval in the near future. And eventually, we want to continue innovating on our existing product to fulfill our mission of helping anyone keep track of their health in a convenient and cost-effective way, and ultimately make healthcare more accessible to everyone in the world. So I'd like to thank you all for listening, and hopefully we'll get to some questions at the end of the pitches.
Great stuff. Thanks, Nicole. There was just a quick couple of questions there. Probably you can answer us at this point.
Oh,
it's
great.
asking whether it's just is it a medical device, and whether their skin color and lighting conditions affect the use of it.
Great. So if this is not yet a regulated medical device, this is currently being used as a health and wellness tool, but we do have a number of studies planned to generate the evidence necessary to file this with a regulatory provider. And then regarding skin color and lighting conditions, actually we work quite well even on individuals with darker skin tones. And sometimes what can happen is for darker skin toned individuals, we have higher melanin concentrations, so including myself. And that sometimes absorbs some of the light reflection that we need to measure to extract these parameters. But we found a way to amplify these physiological signals. So we have no ethnic bias, and we are able to as well normalize to certain lighting conditions. The only condition where we really fell down is when there's no light. So for individuals in a dark room, this would actually be impossible for us to extract these physiological signals. And I think there was another question regarding whether a risk assessment is provided. We do actually provide a baseline risk assessment on what we're seeing, and these are based on baseline physiological thresholds that our Chief Medical Officer, Professor Stephen McKinnon, has come up with. And these are typically simple thresholds to see if an individual's resting pulse rate is beyond, let's say, a certain value, which is 100 BPM, or their respiratory rate exceeds 30 RPM, or their oxygenation dips below, let's say, a threshold such as 94%. So we have simple thresholds in place, but as we add more features, we'd like to conduct a more comprehensive risk assessment. And hopefully our partnerships with some of the academic organizations that we've secured as part of this program would help us do that.
Great stuff. Thanks a lot for that. So there'll probably be some more questions we can look at in the end as people kind of think of things as we go along. But thank you very much. I will stop spotlighting you now, and then we'll move on to our next company today. So the next person we have up today is Craig from IMI. So I will just spotlight him so you can all see who Craig is. So hopefully should be in the screen there. So Craig, over to you.
Good morning. Thank you for the introduction, John. Good morning, everybody. My name is Craig Chater, and I'm here today to introduce my company to you, which is called IMI, and it's named after my daughter, Imogen. She's the one who inspired me to start my own business, and if it wasn't for her, I wouldn't be here today. IMI has a meaning of imagine making memories everywhere. Now, my daughter suffers with Williams syndrome, which is a rare genetic disorder that affects each individual in different ways. 3 years ago, Imogen showed a very peculiar interest in VR when we bought a simple VR headset for your mobile phones to go in. When my son was using it, Imogen was very, very eager to have a go, as any child would. On her turn, she became very distressed and her anxiety spiked dramatically. Imogen started having a full meltdown with a massive sensory overload. So we calmed her down and she never used it again, which was really upsetting. Within the months, when we grew up as a family, we also noticed that Imogen would have sensory problems in other different locations. We also noticed as well, when Imogen attended hospitals, from appointments to being admitted, she would get very stressed and have sensory problems within the hospital. At this point, I said to myself, I wonder if there's a way for me to tackle this problem by using VR. Imogen showed a very peculiar interest in VR from the beginning, and as a father, it wasn't nice to see something she wanted to use but couldn't use it. I noticed at the time there was nothing designed for children that are disabled as well. So while working as a head chef, I worked even longer hours and even more hours and teach myself all the relevant skills I needed to start making my own VR sensory productions for Imogen. I started making simple productions to encourage Imogen to enjoy VR again. Production after production, Imogen started getting used to the VR and was liking the sensory environment I created for her. To our amazement, Imogen started showing signs that was benefiting her health, from mobility skills, motor skills, and mental health, memory capabilities. It was just an amazing sight to see as a father. Imogen's school even took notice of her progression. When I showed the teachers what I was doing with her, they were amazed. So with the parents and school permission, I conducted a small trial to see what I could create can benefit other children as well. The results were outstanding. I had teachers in tears because the children were doing things they would struggle to do. On that day, Imi was born and my journey began. From our R&D I conducted, we modified Imi so it became a physical children's book. They would hold and read together with parents or with carers. On each page of the book would be a different sensory adventure we have created. At the bottom of the page is a QR code that we've coded ourselves. You take your smartphone, you scan the QR code, and your phone transforms into that sensory story in VR, giving accessibility on a mass scale. Also giving the children a one-to-one to themselves and a world of sensory beauty to provide a better well-being for themselves. Now imagine your child is in the hospital. They're in a room, 4 walls, a TV, a window, limited playtime in a creche. Especially during this pandemic, there's been no playtime in a creche for any child. Their anxiety kicks in and they're having sensory problems, or a doctor wants to examine a child and they won't let them, or they start having a meltdown. There's numerous scenarios at the minute with children in hospitals. Now imagine if you had Imi. This can mitigate all those problems by providing a sensory-driven VR world for them to relax in, to provide sensory therapy and distraction therapy. Over the years, I've worked very hard on Imi, trying my hardest getting this ready as a product, but was met with some very difficult challenges. My work was very demanding as head chef, but also my personal health took a turn for the worse when my liver failed on me and they also found a tumour in my bowel, which delayed me making Imi. But it also didn't stop me from doing what I'm doing today, because I'm sat right here. A break came at the same time, my health became much better when the Design Council made a brilliant documentary on my work to provide a better life for someone. It was quickly picked up as well by the BBC, national and international. Then other media groups around the world did a cover story on Imi. To this day, we've gained traction of over 5 million people who felt inspired by my work. After the traction I gained, I also got approached by some people who are still to this day involved in my work and provide help and support when needed. We've got Framestore Studios, who are Hollywood's CGI and VR centre for big blockbuster movies. We've also got Steve Sherman, who's our Microsoft educator. We've got Dr. Jared Van Vungen, who is a professor from London University who studies education and neuroscience for children with disabilities. We've got Daisy Publishers, who's also supported making this book as well. And obviously, this Propel program that we've on has also been a massive help for me to gain extra skills. At the current moment, I'm working solo on Imi, but I have gained some great skills along the way on my journey and got some great support from what I've just mentioned. To move forward, I will need to produce a team, but look how far I have come by myself, which shows the motivation and determination. From their support, our product is in the finishing stages. We have a fully working prototype, which we've recently supplied to a few families to collect data from, and results are coming in, and they're very, very promising and exciting to see. In the future, I do have big plans for Imi to keep making it bigger and better and improving our product. In the meantime, I would love to connect with others to help Imi move forward even further and to find a clinical champion to start observational studies to help families and children who are admitted in hospitals. I already have approval of some medical professions who see the great value with Imi, so I can see it helping others as well. Thank you today for listening to my presentation, and remember Imi, imagine making memories everywhere.
Fantastic, great, thank you very much. We just hear little voices in the background there, as usual. That's that's all part of what we're doing. But thanks, yeah, I think obviously you've got your prototype up and running now, and it's really good to see see you moving forward and just the impact you've made over the past year. So if people have a Google for IMI, the BBC story film is a really impactful piece to do. So it's definitely worth having a search out for that and yeah, seeing how it's all worked. But thank you very much. Thank you, Craig.
No, thank you.
That's right. So I'll unspot. There we go. So next today we have Erica is up next. So I'll just spotlight Erica as well, so everyone can see.
Thanks, John, and good morning, everybody. So, my name is Erica, and my startup is focused on providing a technological solution to support women going through menopause. So, a little about me. I have over 15 years of experience with frontline healthcare as a pharmacist, and have worked in community, hospital, and clinical support. I am passionate about healthcare, improving patient outcomes and well-being, in particular, how technology can transform care and improve access to essential services. So why menopause? It is predicted that by 2025, 1 billion women will be experiencing menopause. 84% of menopausal women believe that their symptoms will interfere with their daily lives, with 12% saying it will be debilitating. The British Medical Association conducted a survey of 2,000 female doctors and found that 90% of their symptoms of menopause have impacted their working lives, with 38% saying that the impact was significant. The research that I have done, I have found that women have even left the workplace, in fact, have not been able to cope. This obviously has economic implications, as experienced women are leaving the workplace. There are also healthcare prescribing costs, as women often visit the GP on many occasions and go through a batch of unnecessary tests, treated for misdiagnosed conditions, as menopause often presents in different forms and are missed by some GPs. Most GP appointments are for 10 minutes, which obviously is inadequate to cover a menopause consultation. There are over 30 symptoms with menopause, and sadly, most women don't even know they're approaching menopause. This phase of perimenopause can last from 7 months to several years. There's also a great deal of health inequalities linked to this physiological change, which impact over half of the population. But it's been a social problem. This is also quite personal to myself. My mum had a hysterectomy, and as a result, put her into menopause. She suffered horrendously with her symptoms and never sought treatment or relief for it, which ranged from the hot flushes to her ankle fracture, taking a very long time to heal due to increased risk for osteoporosis, and other psychological symptoms she faced. There is now more information available than ever, yet a lot of women aren't aware and don't even have the time to go through trying to get a mouth of information. They want information that is precise and easy to digest. My solution is to provide a platform that will empower women to live healthy, happy lives and give them the information required to make informed choices, and also sense of community support from other women also going through menopause, which can sometimes be quite a lonely journey. We will also provide symptom advice on how best to manage it, personal advice and recommendations given by AI, understand of how their hormones impact their health and well-being and how best to manage it. Also treatment options, either hormonal or non-hormonal methods, and also perhaps suggestions in terms of how to manage the skin, hair and change that often happen during menopause. Also the awareness of the psychological symptoms and understanding of the cardiovascular and osteoporosis risk. But also for women to have a clear understanding of whether they're perimenopausal, which is still an area misunderstood by a lot of women I've spoken with. The future goal would be to have user profiles where we can have predictive and prescriptive elements based on their data, where they receive tele-recommendations based on the health status from modifiable factors such as diet and exercise, whose aim is to help them manage future symptoms. Women approaching menopause often are busy raising families and re-establishing their careers. The impact we want is women to feel supported, empowered to make informed decisions about their health. Within my area, there is a menopause clinic which serves 2 of the Yorkshire and Humber CCPs. They also accept referrals from other nearby areas, so as you can imagine, there's a long waiting list to be seen by the specialist. This platform works really well as an adjunct for women whilst waiting to be seen by the specialist. They can get advice and support, and also consider other treatment options available to them for their appointment. I also have the local women's health and wellbeing lead, and the company that to run the Menopause Day was really interested in actually having this in place. So it would be great to have the support of strategic partnerships to really bring this vision to life. Thank you for listening. I also would like to thank the Propel program for an amazing opportunity to be able to learn and to understand a bit more about how to bring innovation into the NHS. So thank you.
Great stuff. Thanks, Erica. No, on the selection day, menopause is just an area which just isn't on many people's radars, or the awareness isn't there. It's a very complex thing to manage. So that's one of the reasons we wanted to kind of get you on the program and develop these areas further. So yeah, it's been great to have you on, and yeah, we'll continue help you as you move on.
Thanks.
Okey-doke. So I'm just on the spotlight. There you go. There we are. And next up we have Sally from CAI. So bear with me a sec. There we are. Up we go.
Hello, can you hear me?
Yes, that's good. Yeah, thank you.
John, thank you so much for the introduction, and thanks everybody for being here, and thank you to the organizers for the opportunity that you gave us of being part of the Propel cohort. It's been very, very amazing. So I'll just start with the introduction to my company. So hello, my name is Ale. I'm the director and co-founder of CAI. And at CAI, we're working towards empowering radiologists with AI to provide a timely and accurate image diagnosis. The demand for imaging diagnosis is increasing, and so is the shortage of clinical radiology, which sadly results in a delayed diagnosis and lower quality of patient care. So radiologists are working outside their contracting hours to try and meet the demand. They're exhausted and they're overworked, and sadly patients are still waiting more than 30 days for a radiology report. So the status quo is no longer an option. Our technology can reduce the workload of radiologists, speeding up diagnostic times, providing accurate results, and at the same time, saving costs. Our algorithm automatically scans the X-rays for any signs of fracture, and it generates a radiology report that compiles the findings. We can speed up image interpretation by providing gold standard diagnosis at a much cheaper price in a scalable fashion. At the moment, radiologists carry around 20 images per hour. With our product, 100 can be processed within that time. So we can reduce the reporting cost to only 20% of the current price and accelerate interpretation. So radiologists can redirect this time to other urgent and more complicated areas, and hospitals can report back to patients within a few hours. The AI can also be a diagnostic support tool for a variety of healthcare professionals at the first point of consultation when radiologists are not available. And it could be a great support tool in remote nurse-led hospitals. The final product will be cloud-based, and it will be able to integrate into the current NHS PACS system. But we're not working alone. There's a great team of domain experts working with us together to help us bring this solution into clinical practice. My co-founder and I are computer scientists, and AI researchers from the University of Leeds are part of our technology team. But to build a product that addresses the real needs of clinicians in their everyday practice, we're collaborating with radiologists, orthopedic surgeons, and emergency medicine specialists from the Leeds Teaching Hospital Trust. We're all working closely to bring this solution into routine practice and improve patient care. As a starting point, we're targeting wrist and ankle bones, as they are two of the most common bones to be suspected for a fracture, and also two of the most commonly misdiagnosed. After this technology is complete, we will expand to other body parts, and we will help reduce a much bigger part of the workload of radiologists and allow them to focus on more complex tasks. In particular, we're very interested in helping detect fractures of hands, feet, and hips. So we've been working with NHS Scotland for the development of a proof of concept and a working prototype of this technology, and it will be complete in the next month. We have trained our algorithms with over 20,000 patient images, and we have reached a similar accuracy as a radiologist specialist. In the next coming months, we will get additional 30,000 images, and with this, we will working on improving the AI algorithm further. Patient safety is our paramount. So after finishing our working prototype, the next step is to conduct clinical validation of this technology and to show its value and its benefits in clinical practice. We're aiming to build the necessary evidence to adopt our technology in real-life settings. So we're looking for advisors and we're looking to grow our collaborations to make this happen. Because with our product, we aim to close the gap between supply and demand for imaging diagnosis, and get to a world in which patients can receive their diagnosis within minutes. If you're interested in collaborating with us, feel free to reach out to us after the event. Thank you very much for listening.
Great stuff. So thanks a lot for that. I think, yeah, as I say, it's one of these AI is a key area that everyone is much more aware of these days, but it's a tricky journey to get to acceptance of use, and it's something we'll work with you and in the longer term, and hopefully kind of see it out there and in use. And from my point of view, it's great area to get involved with and understand more. So thank you very much.
Thank you very much.
So I think we have. Oops. We have Melissa next on our list. So I will just share Melissa's screen.
All right. Can you hear me? Can you see me?
Yes, perfect. Thank you very much.
Thanks, John. So my name is Melissa. I'm founder, CEO at WarnerPatch. First of all, big thanks to John and Don and all partners with Propel. It's been really acceleration definitely onto what we're doing, into understanding the real things of what's been happening behind the scene. So very grateful to have met also the cohort, incredible founders and great journeys. So I feel very humbled to be part of this community now and forever. So thank you so much. So now back to WarnerPatch. So WarnerPatch is a medical device connected to an online platform. So its only reason of being is to allow better and safer remote monitoring. So I have it here. So it comes with a non-invasive reusable main unit, and we have a disposable sensor. So the main unit is rechargeable. We have a 7-day battery life. And with security in place, data is sent using 5G connection. So just like phones, essentially, to our online platform. And clinicians can access the data remotely to either escalate or not a patient, so towards potential further follow-up. And they also get reminders. So although we're currently focusing on near real-time monitoring, we see that with aggregating all that data, we can use artificial intelligence for disease evolution prediction. So towards preventative care, as complications could be detected much earlier on. So either patients could come for outpatient appointments or even for earlier intervention. So essentially, the big vision of WarnerPatch is to allow for a connected virtual ward for high patients. So essentially, with early discharge in a safe manner. So in that example, patients would receive WarnerPatch at the point of care and be able to go home with it. But we're also seeing WarnerPatch allowing for continuous virtual outpatient. So that would be for better follow-up and appointment management. So also thinking about the home nursing provision and minimizing health inequalities. So the vision we have is to essentially bridge the gap when patients are outside of the clinical setting and without disrupting what's already out there. So using the latest technology to empower patients and facilitate clinicians' work. So it's a huge vision, but currently we're focusing on one thing, which is patients with high risk of losing a limb due to vascular disease. So very briefly, vascular disease is essentially this is when the blood vessels are blocked or they rot away from within. So essentially preventing any blood, any nutrient to go through to the rest of the limb. And that often creates ulcers or wound. And that could also lead to embolism, sepsis, and even death. So that's a condition that can only stabilize over time or get worse. So if a patient comes to be amputated, then we have only 50% survival rate after 2 years and a very reduced quality of life if they do survive. So with the pandemic, the number of high-risk patients had sadly increased by 60% on account to our clinical champions, review on what's been happening out there. And so it's been, the word out there within healthcare professionals. We need to provide another way to give that high quality of care that the NHS in the UK has been able to do. And so WannaPatch aims to be part of that solution. So we have been awarded a few grants to finalize the R&D, both on the hardware that I just showed you and the software, so the web application. And we are now preparing towards regulatory approval and a clinical study to show efficacy of the device in those post-operative patients, so really that virtual ward that I mentioned. So we've also will be leaving a device for testing freely in the Healthy Living Lab from Satellite Catapult. So I encourage you guys to have a look at the website. It's huge what's happening there. And so we're now looking to find additional healthcare partners to understand how WannaPatch could be adopted for the NHS benefits and potentially beyond. So thank you so much for listening.
Great stuff, Melissa. Thank you very much. Yeah, remote monitoring, obviously a very kind of hot topic at the moment with obviously the change in working, all the challenges that COVID has presented us with. So yeah, it's really good to see 5G connected devices. It's the stuff of the future, isn't it? So yeah, it's good to have you on the program and getting involved. So thank you very much.
Thank you.
Thank you. So and next up we have Galib. So I think Galib's camera is having issues at the moment, so we won't be able to see Galib, but I will let him start talking away. There we go.
Hi everyone. Thanks, John, giving me this opportunity. I'm going to quickly share just one slide because no one can see my face, which they're probably lucky, and just it's this slide. So I'm going to quickly just go over. Actually, sorry. Let me. Oh, wrong. Where's it gone? Am I still presenting?
Yes, yeah, I can see how it works in our IP. I think was the slide.
Okay. Leave. I think I was in the wrong slide. Hi everyone. So my name is Galib, the founder of Bit Medicine. I would like to thank John and the wider Yorkshire and Humber AHSN for the support over the past couple of months, especially with their classes on clinical safety and legal issues and stuff like that. So COVID-19 has highlighted pre-existing health inequalities within the Black and South Asian communities, and language and communication barriers contribute towards these inequalities. I'm surrounded by these communication barriers, both at home and the pharmacies I have worked in. So my grandmother was deaf and mute from birth. My mum speaks English with a limited ability. My eldest son has Down syndrome and wears a Baha hearing device. And topping this off, I have dyslexia and dyspraxia as well. So pharmacy and pharmaceutical industries in the UK are globally poorly equipped to reduce health inequalities for such patients and carers, especially around medication information accessibility. In the UK, 8 is the average reading age, and personalised medication information at the point of prescribing and dispensing and beyond is not fit for purpose, especially for those with communication barriers. These people who have these communication barriers will also are more likely to have a higher burden of disease and multi-morbidities than the general population. This includes people with age-related mental decline, limited ability in spoken English, such from the Black and ethnic minority community, people with low literacy, sensory needs, and special needs and learning disabilities. Communication barriers lead to miscommunication and miscommunication of medication instructions, as a third of all patients have a limited health literacy. Miscommunications is the #1 factor in medication safety issues as well. So 12% of all unplanned hospital admissions is due to some kind of medication safety issue. 10% of all prescribed medicines are wasted, and up to 70% of non-adherence rate to prescribed medicine as well. So this is in ethnic minority patients, especially in those with language barriers, and this is academically evidenced. So all service users should have access to easy to read, digestible, unambiguous, accessible medication information at their convenience. You can meet, society already meets these provisions from education to finance, but not around healthcare or medicines. So real medicine can bridge this gap and reduce inequalities. We're a provider of an evidence-based, innovative product that enables healthcare professionals to provide crucial accessible medication content and bilingual content that's customizable to the patient's preferred format. So we've done this in simplified and standardized English, where we've codified the content that allows it to transfer from one IT system to another IT system. Additional languages, pictograms, large fonts, and in the future audio files as well, which can be mapped to the original content. And we can do this by via APIs and integrating into third-party IT suppliers, and to print, for example, bilingual pharmacy dispensing labels, or a A4 medication summary sheet that will explain in pictures how to inject a particular medication or inhale an asthma device. And you can also map it to like to send text messages and all other kinds of products as well. So our academic study have suggested that we can increase patient safety by 60%. We've improved communication from 38% to 89%, and improved patient's experience by 80%, where 80% of the patients wanted this as a regular service. In 12 community pharmacies we did a project in, of which 66% even thought it would influence their choice of pharmacy. And most importantly, we improved medication adherence by 82%. At the moment, our product is live in, we're going live in Barts, but we're live in Luton, Dunstable, Bedfordshire, London North West Healthcare, which is Norfolk Park, Central Middlesex and Ealing Hospital, East London Foundation Trust, and we're about to work on a project with Bradford Teaching Hospital, Bradford District Care, and the CCG with NHSX, and this is funded by NHS England. So that's some information about us. Please do get in touch with us via John, and be happy to get more customers. Thank you.
Great stuff. Thank you, Galeb. I think it's translation of labels is, I think it's one of those things we've always said is, I think most people just expect it's already there, but in reality it's just not. So yeah, I think it's one of those things we can all definitely see the impact and the potential of, and increasing adherence. The clinical outcomes of those, kind of a simple kind of IT solution, improving in adherence in those kind of numbers is very impressive. So yeah, it's been great having you on the programme, and yeah, it's hope on to keep supporting you with the work in the region. Thank you.
Thank you very much.
Great stuff. So up next we have Lauren from MyFood24. So I'll pop you in the middle. There we are.
Great, thanks, John. Can you hear me okay?
Yeah, that's great. Yeah, sounds good.
Brilliant, thank you. Hi everyone, I'm Lauren. I'm a nutritionist working for Dietary Assessment. We're a spin-out from the University of Leeds, founded in 2017 by Janet Cade, a professor of nutritional epidemiology at the university. And we are on a mission to reduce diet-related disease globally. As we all know, poor diet is a major challenge across the globe. It is now responsible for 1 in 5 deaths, overtaking smoking as the #1 risk factor for deaths worldwide. Diseases linked to poor diet include obesity, type 2 diabetes, cardiovascular disease, some cancers, and malnutrition, among others. And these are all having a considerable impact on our healthcare system. Obesity-related diseases alone are costing the NHS £6 billion a year and £27 billion a year to wider society. But these diseases and their impacts are preventable, so why are numbers continuing to increase? Well, put simply, healthcare professionals and their patients don't have the tools they need to effectively monitor and improve nutritional intake, which is key in preventing and managing these conditions. Many healthcare professionals are still using traditional paper-based methods, which require them to manually enter food items eaten by the patient into clunky analysis software to calculate their nutritional composition. This takes considerable time and effort, and it can lead to errors and misinterpretation, particularly as they often lack branded level data or it could be outdated. Some healthcare professionals may refer their patients to use consumer apps to record their diet, but their databases tend to be crowdsourced, meaning results aren't always accurate. They can also have missing nutrient information, as they're often designed just for weight loss, so they typically focus on calories, lacking some other key nutrients. And in most cases, these results are not shared with the healthcare professional, making it really hard for them to oversee and intervene appropriately. We believe our nutritional analysis software, MyFood24, is the solution. It's a self-completed online food diary that automatically calculates the nutritional composition of food, and this information is instantly shared with both the patient and the healthcare professional. It was created by Professor Janet Cade at the University of Leeds with a £1 million grant from the Medical Research Council using robust and evidence-based methodologies. Biomarker validation of the system found that MyFood24 was a more efficient way of measuring diet and nutritional intake compared to traditional methods, and that was due to the speed and accuracy of the system. MyFood24 is underpinned by a unique food and nutrient database created and quality checked by our team of nutrition experts. And unlike other systems out there, our data is never crowdsourced. In fact, we've worked really hard to provide comprehensive data on over 100 different nutrients, vitamins, and minerals for 62,000 products that are available today on supermarket shelves, restaurant menus, and fast food outlets to provide a more complete and representative nutrient picture. MyFood24 is being used extensively in research and higher educational organisations across the globe. So far, we have 6 different country-specific versions with several more under development. We've now tailored our system for use within a healthcare setting. This includes a dedicated web portal for health professionals and a patient-facing mobile app, downloadable from the app stores. Healthcare professionals can set each of their patients' customised nutrient targets tailored to their needs. Both users can then track against these remotely to see their progress over time. And a series of notifications and graphical feedback can help keep their patients on track and healthcare professionals informed to be able to intervene when needed. MyFood24 will give health professionals complete and accurate visibility of their patients' nutrition to quickly and easily identify where additional support may be required and to tailor their plans accordingly, leading to better patient care. Patients will receive accurate and personalised nutrition care, empowering them to confidently manage their conditions through better and informed dietary choices, leading to better health outcomes and an improved quality of life. Our health system is currently being piloted at hospitals in Leeds and York in gastro and tier 3 weight management patients. And now what we're looking for is more pilot sites to help test our system in other areas. We see MyFood24 being able to support a range of different healthcare professionals in primary and secondary care and their patients for conditions including diabetes, cancer, IBS, malnutrition, just to name a few. Really, anywhere where diet plays an influencing factor and needs to be monitored or improved. Similarly, we're looking for channel partners who understand the important role that diet plays in health and well-being, but perhaps don't have the ability to assess this themselves. So please do get in touch if you'd like to find out more about MyFood24, or if you're interested in being a pilot site or a partner. We'd love to hear from you. Thank you for listening, and thanks John and everyone involved in the team. It's been a great opportunity and I've definitely learned a lot, so thank you.
Great stuff, Laura. Thank you very much. Yes, I think the power of the database is a key part for you, isn't it? And I think bringing that into a kind of patient-facing kind of pathways will make a big change. And again, it's that clinical impact that it can make is very hard to quantify. It's how positive it can be. So yes, great to have you on the program, and yeah, we'll continue to help you along the way.
Brilliant, thanks, John.
There we go. So I'll put your spotlight off. There we are. And then we have Kevin from Co-ops is next on our list. So I'll bring Kevin into focus in the middle. There we are. So over to you, Kevin.
Hi. First of all, thanks, John and Propel. We targeted this program back in sort of late summer last year, and we were really very happy to get on it. And as I was telling John earlier on, it has exceeded our expectations in every sense. So really happy to be part of the community there. So hi, I'm Kevin, and I'm one of the co-founders at Co-ops. We're automating note-taking in therapy sessions and creating the data that's missing from mental health. The team is myself. I've got a background in technology for over 40 years, 20 years in finance, 20 years in startups, and I've been building distributed systems on and off for about 40 years. Jeremy is one of the highest qualified therapists in the UK, and he's qualified to deliver 6 different therapies. And he was a founding member of the team that created the Cyclops measure and previous national lead for student mental health in the UK. Elaine Boosfield is our only advisor at the moment, and she was previously founder and CEO of Kooth PLC, the first publicly listed mental health company in the UK. I want you to imagine a place where help is offered to people with mental health problems within 24 hours of reaching out, where 1 in 2 patients are helped recover, where there's lower clinician burnout, sick leave, and vacancy rates, where patient relapse rates are lower, where the medication levels are between 1/3 and 1/5 of the levels in the UK. It's not a fantasy, but the place that should have the worst mental health numbers in the world, but has the best, it's Lapland. Their performance is the standard we are aiming to emulate through our innovation. This matters, as 12 people in today's audience will join the 12 million people this year with a mental health problem in the UK. But only 2 of you are going to get help from mental health professionals. And then clinicians will only manage to help 1 in 7. So for those 12 people, you face pretty poor odds. This costs the UK over £115 billion a year. That's almost 8 times the impact of cancer in the UK. But cancer's research budget is 4 times greater than that for mental health. One of the impacts of that discrepancy is that mental health is stuck in a time warp. The only tools the therapist has in the therapy room are the pen and notepad and the couch. Yet, despite patient need, NHS clinicians spend over half their day in administration, where writing up the session notes is the biggest segment. We know from looking at OneTrust's digitized records for 10 years that those notes aren't inconsistent, nor are they transferable. And as a result, they probably form a poor basis for research. Our solution is to focus on the 40% of human communication that is down to tone of voice, pacing, conversational behavior, and to free therapists from the twin evils of multitasking and the implied context switching that comes with that by automating note-taking. Anna is a device that will save therapists up to an hour a day, which could lift the daily average patients treated from 4.7 to around 5.7 per day. It creates the possibility of a virtuous circle by reducing clinician stress, and by being a second listener in the room, it also addresses confidentiality concerns by being Snapchat for therapy. Lastly, we believe that giving the patient a copy of the summary will encourage active participation in their own recovery, which is a big problem for digital interventions in mental health so far. Our vision is to move the needle on the number helped by therapists from 1 in 7 to 1 in 2, which is Lapland's number, to create the data to enable new AI-driven solutions, and to have the infrastructure rails ready to deliver those future solutions in place, ready for them when they come. It's a big opportunity. The government has committed to spending an extra £10 billion to double treatment numbers in the next 3 to 4 years. But current clinical vacancy rates are 13%. So clearly, a productivity boost like we're offering is the only feasible solution. There are almost 750,000 English-speaking therapists in the world, with about 80,000 in the UK, with 38,000 in the NHS. But there's also adjacent markets, markets like social workers, and there's almost 108,000 of those in the UK, and about 850,000 in the English-speaking world. Today, we've won an Innovate UK grant to build our beta product. We have 2 research collaborations in hand with the University of Leeds and other academic institutions, and we have 3 potential pilot sites. What we'd like from this audience is investment to help pay for our pilots, academic collaboration for grant-funded research in the areas of AI and psychology applied to this space, and engagement with innovation managers within the NHS. Thank you, audience, and thank you, Propel.
Thanks, Kevin. Very good, thank you. It's again, it's the potential impact of the solution, you know, is enormous. You know, for going from digital, traditional paper notes to digital notes, and just the sheer administrative impact that could have is yeah, blows my mind a little bit. So, but yeah, it's been great to have you on the team, and it's that yeah, sort of. I think when you showed us your kind of physical prototype in your hand, that was I think on the assessment day, that's always something nice to see, something, you know, physical object in these kind of digital times. So no, thank you very much, and we'll continue to help you along the way. Great stuff.
Thank you.
Cool. All right. There we are. So let's bring Kevin off the top now. And then we have, I think it's Alexandra from Euphonia is next on our list. So I'll just make you center stage.
Great, thanks, John. Can you hear me?
Yes, yeah, perfect.
Great,
Thank
perfect. Cool, thank you so much. So I'm Alex. I'm a qualified lawyer, and I joined Euphonia as head of operations last year. And I've been attending Propel with my CEO, Nick DePennington. Thank you so much for having us, and we've learned so much along the journey with everyone. So essentially, we're a productivity tool for clinicians, and we use voice AI to automate outpatient conversations. So we make routine clinical follow-up calls as easy as ordering a lab test. And by automating telemedicine calls, we can deliver routine care at scale, reducing costs for providers and payers, and increasing staff capacity and productivity by improving convenience and reliability for patients. The recently issued NHS planning guidance incentivizes trusts to increase the delivery of activity this year to begin to deal with the backlog of clinical activity, and Euphonia provides a route for them to achieve this without requiring an increase in staffing. So our first use case is follow-up after cataract surgery, which is the most common operation in the NHS and globally. 28 million cataract surgeries are actually performed per year. We've been developing this with the support of Innovate UK funding and a pilot site at Buckinghamshire NHS Trust. We conduct an automated, clinically validated natural language telephone call with patients as a replacement for a conventional follow-up visit. And this provides assurance to clinicians and their patients. We've also started conducting the calls for patients live and have a net promoter score of over 60. Cataract follow-up is a reproducible template for our next use cases, which will be follow-up after other routine high-volume ambulatory procedures, which has a market of over $2 billion. In terms of milestones, in the coming months, we will be starting an NIHR clinical trial supported by the NHS AI and Healthcare Award. We'll be continuing a European collaboration demonstrating our multilingual potential. We're launching a research partnership in Hong Kong to access the Chinese market. And we're also developing a pilot of colonoscopy follow-up for the US, a market of 10 million per annum. We have an amazingly talented multinational team with the experience and expertise to deliver our vision. Our CEO, Nick, is an Oxbridge-trained former neurosurgeon and digital lead in the NHS with 15 years of experience. And we also have the backing of an incredible team of advisors and investors, including here at Propel. In particular, the Hill Dickinson support we received through the program was incredibly timely, as it helps us confirm our understanding of the regulatory, data compliance, and legal landscapes while preparing contracts for live use this year. So we really benefited from that in particular. And importantly, we have also shown that our platform also has environmental benefit by partnering with the Center for Sustainable Healthcare and demonstrating significant carbon equivalent savings. So our future roadmap, during the program, we obtained our first CE mark, and we are now raising a seed round to support commercial traction in the UK and the US. This will complement our existing grants to grow business development, develop our product, our data products, and support costs associated with gaining regulatory approval, which is really important for us. We will continue to add clinical use cases and geographic territories, starting with English language health systems. In particular, the Propel program has helped us connect with stakeholders across the Yorkshire and Humber region, and we have been working with the AI lead at Bradford and the Assuring Autonomy Research Group at the University of York to establish a collaboration to develop a methodology for the safe implementation of AI, which we're really excited about. We are also in discussions with the Bradford Ophthalmology Unit about establishing a pilot with them for cataract surgery and exploring the possibility to co-develop further use cases with them in other services where they are facing high operational pressures. And thanks very much again to you, John, and everyone at Propel for an excellent program over the past several months. And yeah, I'm happy to connect with anyone interested in discussing in more detail.
Great stuff. Thank you very much. Thank you very much. I think on the original assessment day, I think it was particular note around the accessibility of your solution, given it's a telephone conversation. It's digital, but it is a solution for all. And also, the potential applications are very, very broad. So yeah, I think it's a great idea, and we want to keep watching you and help you moving on. So thanks very much for taking part today, and we'll keep helping you along the way, hopefully. Thank you.
Thanks.
Great stuff. So we have one final presentation for us today, who is Ravi, which I will just share his screen. There we go. So this is Ravi from CyberLiver.
Great. Thank you, John. Can you hear me okay?
You're a little bit quiet.
Yeah. Can you hear me okay? Better?
Yeah, that's a bit better. That's a bit better. Yeah.
Yeah. Thank you. I take the opportunity to thank you, John and Don from Barclays, and all the partners from the Propel. I'm really grateful for help and mentorship and all the learning which you guys have provided for the last few months, and the friendship of my colleagues who were co-participants here. I am Ravi Kumar. I'm founder and CEO of CyberLiver. I'm a technologist and a management consultant by training, and I've spent the last 3 decades of my career in health and tech, building and commercializing technologies for the NHS in the UK, and also Harvard Health System in the US, and across 40 countries in Europe and Asia. My previous entrepreneurial journey, and I was part of a founding team that took the health tech startup to a public company with excess of $500 million in revenue. This time, my focus is liver disease. Liver disease is, it impacts 844 million people in the world and kills over 2 million people every year in the working age population. And that's more people than COVID pandemic. There are 2 billion people in the world who consume alcohol, and nearly 1 billion people are obese. Liver disease is increasing by 400% since 1970s, and this is according to British Liver Trust. Liver disease is the third biggest cause of death in the working age population in the UK, and is the fifth leading cause in the US. We are on a mission to reinvent this liver care, to develop and commercialize prescription digital therapies to halt or reverse the advanced liver disease in conditions like cirrhosis. Using a therapeutic class known as prescription digital therapeutics, where software-driven interventions are the new molecules, delivering clinical outcomes, either directly or in combination with other pharmacotherapies. We are developing software as medical devices, so we are regulated as a medtech company under SAMD and an IVD programs. Let me tell you about Cindy. Cindy is a patient and whose life has changed as a result of CyberLiver and impacting positively in her life during our clinical trials. Cindy is a 35-year-old with a young family, working hard, holding on to a job, looking after family, just like many of us. Cindy used to drink socially to take the edge off the day, but somewhere along the line, drinking has become a real problem without even realizing it. One day she collapsed at home and got admitted, where she was diagnosed with alcohol-related liver disease. She probably was drinking a bottle of wine most days of the week, and she thought she's healthy and didn't realize that it's actually hurting her health and she's damaging her liver. And the doctors told her that if she continues to drink, she will develop cirrhosis and she would need a liver transplant and she could die. Only way for her to abstain is from alcohol. That's the only real treatment for alcohol-related liver disease and ultimately falling into cirrhosis. Doctors have tried many drugs and standard therapies through alcohol teams, but nothing worked effectively for her. This is when hepatologists at the Royal Free London Hospital, our partner, enrolled Cindy onto our AlcoChange clinical trial, and things started to change for her. Through the use of what we call a continuous motivational behavior therapy, delivered by AlcoChange. This is our CE-marked patented technology. Week 1, week 2, week 3, week 12, and the results amazed us. Cindy is back in control. Cindy is one of 60% of real patients in AlcoChange clinical study who experienced a positive change using our technology. There are over 3 million people like her in the UK we can positively help. Cindy was lucky to have stopped the progression of liver disease using AlcoChange. Many are not that lucky. As I said, over 2 million people die every year of this advanced liver condition. And our products, AlcoChange and SeroCare, they made a real difference here, for Cindy. And our phase 2 clinical studies at the Royal Free Hospital demonstrated 63% reduction in alcohol consumption in the people who have engaged, when compared with 20% in a standard care, and that is threefold increase. Clinical studies also demonstrated a 33% reduction in readmissions in patients with decompensated cirrhosis, during the COVID-19 pandemic. Our early health economic model, based on these studies, indicated a potential of 300 to 425 million annual savings to the NHS if CyberLiver solutions were to be rolled out across the nation. We developed these products with grant funding from Health Foundation and Innovate UK. And our technology is designed by leading hepatologists from UCL here in the UK and in partnership with patients. And we are now ready for our phase 3 pivotal clinical trials. Phase 3 trials typically cost anything up to 2 million per indication, and to generate real world evidence, which we would like to use that evidence to submit to NICE. We have now secured a 2 million grant funding from NIHR for running a pivotal study across 18 sites in the UK in partnership with UCL and the University of Southampton. We're actively seeking funding to match fund these grants and complete our trials and generate real-world evidence to commercialize here in the UK, Europe, and in US. The unmet need and the market potential is enormous. Nearly 1 billion people with liver disease and hospitalization costs of over 2 billion in the NHS and over 69 billion in the US. Me and my co-founder, Professor Rajiv Jalan, we are passionate about addressing this enormous challenge, and we recognize the collaboration is key for our success. We invite you to collaborate with us in this journey and to help us fill this huge unmet medical need in treating the liver disease, which has no effective treatments. Thank you.
Fantastic. Thanks very much, Ravi. Again, it's the potential impact of those solutions. Again, it's sort of liver disease is something we don't necessarily hear about, kind of in the headlines, and it's again it's one of those areas which behavioural changes supported by digital solutions can have a huge impact on individual people, but also the health system and the pressure it's under as well. So yeah, it'd be a good one to watch and support as we go along, really. So thank you very much to all our speakers today. I don't think I've missed anyone off. Please tell me if I have. But I think we've had our kind of 10 companies today talk to us about their solutions. So I'm keen to kind of open up the floor to any kind of questions. If you want to raise your hand in the Microsoft way, we can kind of take questions through there. It'd be good to get some interaction, see some other participants. If anyone's got any questions for the team here, or we can also put kind of questions in chat as well, for if that's people's preferred method as well. In terms of, we have thought we had a question there. So in terms of following today, I was going to leave today with a slide up with my contact details. So if you wanted to get in contact with any of the companies we've talked to today about any of the aspects of support, whether it's supporting them individually or finding more about the program or whatever that may be, please do get in contact and we can kind of facilitate those conversations. So I'll leave a slide up at the end with my contact details on, and I'll put my email in the chat as well as we go along. So just see if we've got any more questions coming through from anyone. There we go. I think we'll give it just a minute or so, just in case anyone else wants to chip in with anything. But I'll use the opportunity to talk about a new Propel program that we're launching in the next, nearly next month in April, which is Propel Net Zero. So building on from the kind of Propel digital health program we've been running for the last couple of years, Propel Net Zero has been commissioned by West Yorkshire and Harrogate Health and Care Partnership, and it's really about supporting businesses which can help the NHS achieve its net zero ambition in terms of environmental impact. So it's a program which will kind of support kind of healthcare companies, businesses, not necessarily digital solutions, but any sort of healthcare business, to help them with support tailored to what they need, based around the kind of net zero environmental impact kind of agenda. So it can be companies who've got existing products, or it can also be companies that just have an idea at the early stage as well. So it's a new kind of addition to the Propel family that we're kind of supporting, and it's supporting a local need as well. So please do keep an eye out for any kind of details if there's any companies that you are or have are aware of that would kind of fit that description. Would be very much appreciated if you can kind of point them in our direction, and hopefully we can help them in the same way as we've been helping the companies that we've looked at today. So that's just a quick kind of heads up to let you know that will be happening in the next month or so. So keep your eyes peeled for that one. I think we've got a hand up from Richard. You got a question?
Yeah. See you later. Yeah. No, I just want to say I'm head of IT and systems for it's a big mental health trust. We do touch on the York and Humber. It's actually been really good. I just wanted feedback. It's really impressed with everybody and the innovation and everything that's going. So And I've been asked to look at innovation for our trust. So Tees Esconwere Valley's NHS is we're a mental health trust. There's a lot of challenges as been stated there. So I am interested in getting in contact with a few people. You did answer that. I'll be honest, I can't remember what everyone does. So I wondered, is there a summary or an appraisal of what will be shared with people of what they do? Because there's definitely a few things there that I was very interested in. And we are building our new patient solution, which is very much, we're redesigning all of our clinical pathways and things. And what I want to do is have interoperability with that, with quite a lot of different solutions that can help speed up and give more time to care. So yeah, a couple of questions really. I mean, overall, brilliant, well done, guys, and very inspiring. Been in the NHS 25 years, and it's kind of like, well, it's good to see such young people as well involved. It does make me feel quite old, but it's I know there's a few oldies there, but absolutely brilliant that the NHS is going to have such dedicated people working with it. But again, if you've got that appraisal of what the companies do, that would be good, and how we can get in touch with people, or is it? I guess is it just through you? Is it, John?
Yes, I'm just putting. I've just put my email in the chat. We've also got our website and Twitter as well. So the website has a summary of each company and further links onto them as well. But I think it's the sort of thing where it'll be good to have a discussion around particular ones you're interested in, and we can kind of help you align them as well. And there's also our Twitter in there as well, which has more information. But yeah, it's great to have positive feedback, and it's kind of it's exactly what we want from days like this, is to get these companies in front of people who work in the system, and just raise awareness, let people know you exist, at the end of the day. So it's it's fantastic to have that feedback as we go along. So yes, I've just popped the details in the chat there as well, but I'll put the slide up at the end with my contact details on, and we can kind of work through some sessions there. So thank you very much. So I don't think we've got any more questions coming through, or any more hands being raised. So I think at that stage I'll probably draw things to a close. Just wanted to say thank you very much to everyone that's kind of taken part today, but also over the last 6 months, in terms of your commitment to the programme. Makes it a lot more of a kind of satisfying, working with kind of your level of engagement, doing interesting things. It's a very satisfying from my point of view to get involved in hearing what everyone's doing and how they're trying to solve their problems, really. So it's been great working with you for the last 6 months. But as we say, it's just this is the start of that relationship, really. As an NHSN, we'll be kind of following your progress through, helping in whatever we can, trying to bridge those gaps to the NHS and get those introductions, get you in front of people who hopefully you can help with your solutions as well. So just wanted to say, absolutely thanks. It's been a pleasure working with you for the last 6 months. I know, and we've got a few more things on the calendar in the future anyway. So we'll be together again a few more times as we go along. But yeah, just thanks for everyone's involvement and kind of efforts you've put in. Good luck to the future. So I'll stay on the call until as everyone drops off. So if anyone's got any questions, wants to kind of stay on, please stay on, and I'll keep the floor open, and I'll put that final slide up as well, just so with my contact details on as well, if you want those at all. So thank you very much, everyone. Have a nice day. Enjoy the sunny weather, and hopefully see you all again very soon. Thank you. Bye.